So beyond what we're doing as physicians, what is the role that you guys think schools, community, and health centers could do in addition to what we're doing to address the impact of food allergies and increase the health equity in these underserved patients?
We try to do some education with the local school districts. We can only go so far just because of our thing, and educate them and do parents' night where we actually go and do a lecture on food allergy and open up to the student body and the parents especially, and just sort of introduce them and give them an overview, like a 1 hour talk, half-hour talk, and little open question and answer type session. And that also helps just begin to open up the conversation and again, give them national resources and websites to go to and so forth, just to start the conversation.
Yeah, agreed. The education is huge. And in PEDS, you also think about, this might be a little off topic, but if you have if you're still in the process of diagnosing a food allergy, a lot of time nutrition can be affected too. And a lot of times you think about, families having to go out into the community and find alternative options for foods if they are having to limit their diet for a food allergy. And that's where some of your community resources come in, like WIC for Kids, food pantries, and thinking about, do these food pantries and WIC have those alternative options available? So also partnering with them and letting them know, we need to have a wide variety of options so we're not limiting nutrition for kids who do have a food allergy. And we have seen that come into a play, families coming in and saying, I would love to give them this, but it's not available and it's not affordable. So I'm just thinking about, creating a list of places where they can go to get alternative food options, or partnering with your community centers and trying to make sure that they broaden access to foods if there is a confirmed food allergy for kids.
Absolutely. I agree with that. Another key thing I feel might be really effective is having support groups. I think that can definitely help spread information about, available allergy support, and then resources, and also help in educating about emergency preparedness as well. Apart from that, I think community health centers can also do periodic health camps or routine health checkups from time to time, covering various schools and such. So that would be really helpful, I would say too.
These are all great things that we all do. And I know our clinic personally sees quite a bit of Medicaid and even self-pay patients, but what are some other ways that we could address these barriers for equitable care? Are there examples for ways for us to increase equity in allergy care on either, like I say, policy, community, or research level?
I think one other thing that I can think of is safety net. So you touched on a point where we have people that we're caring for with Medicaid insurance. There's some people who fall, there's unenrollment happening. Some families don't have insurance and they use the ER sometimes as their primary care, or of course, in case of an emergency. So in addition to us, as specialists and primary care providers doing that allergy action planning, talking to ER colleagues as well and saying, I know you guys are super busy, but if possible, you have a kid or an adult coming in with a new food allergy suspicion, is that something you can briefly go over? If you give them dialogue to say, it makes it easier, right? Just giving them the key points, and then just reminding everyone, the importance of, if there really is truly a concern for anaphylaxis, making sure that everything is in place so that if they can't get to us as primary care providers or specialists, they already have that safety net in place.
Yeah, emergency preparedness is really key, not just for the patient, but for people usually surrounding the patient, be it school staff or sometimes family members or extended family. I think having that safety net is super critical.
And sorry, one more topic too, and I agreed with you, is also, thinking about equitability, not just within background, but also language too. So I think sometimes there's misinterpretation. And we just have to remember, if there is a family that comes or a patient that comes that speaks a different language when we're doing that education, making sure that we're really ensuring that we're doing our duty to use interpreter services correctly, making sure that there's not miscommunication, because, it happens on all different fields of medicine, including allergy education too.
Most of our patients actually will come in with a physical interpreter. And interestingly, when specific insurance plans, which I will not name, choose to use a telephone interpreter, half the time there are technical difficulties that I just rely on Google Translate to complete the interview. And I don't feel great about it. So I totally understand.
Yeah. Our EMR has actually a translator for various languages too that we try to utilize. That helps on the spot too, within our own EMR.